I'm Carl O. I'm a retina specialist with Tennessee Retina in Nashville, Tennessee. And I've just presented here at the ASRS meeting in Montreal late-breaking data of 4D-150, gene therapy for neovascular age-related macular degeneration. I presented data for 2-year outcomes from a group of patients with more moderate disease. We presented outcomes on patients with more severe and recalcitrant disease, but these patients are typically more like the ones we see in our practice, a little shorter duration of disease, less than 2 years, even less than 3 months, and the outcomes have been quite compelling. So in the larger group of patients with disease of less than 2 years, we see a substantial reduction in treatment burden from a single intravitreal injection of gene therapy. So for 2 years after that single injection, around half of patients did not need another intravitreal injection to maintain excellent vision and anatomy. About 67 or 69% of patients needed 2 or fewer injections over 2 years. In a subgroup of those patients, those with more recently diagnosed disease of less than 3 months average duration, we saw an 87% reduction in estimated treatment burden. 87% of patients also went 2 years without a single additional injection, and the overwhelming majority needed less than two injections over 2 years. And what was particularly reassuring is that these really amazing outcomes were achieved with great safety. So of all the patients that have been followed with 4D-150 so far, we have follow-up now up to 4 years in some patients. There have only been 2 eyes with very minimal iritis within the first 28 weeks of injection, and this was handled with topical therapy alone. Other than that, there have been no other eyes with any serious adverse events. So this combination of this sustained treatment that can act as a backbone therapy for our patients with reassuring safety is an amazing combination. Well, in the phase 3 studies, given how impressive the phase 2 outcomes have been, I'd be delighted to see phase 3 mirror those phase 2 outcomes and see this maintenance of vision with minimal additional treatment and excellent safety. That would be great. Gene therapy, we have evidence from other types of gene therapy that it can be, potentially a permanent treatment or at least a very, very long-lasting treatment. So it was very reassuring to see that at the next time increment that we've been able to study, we've been able to maintain good results. Patients tend to lose vision over time if they're treated with intravitreal injections because they tend to be undertreated. The burden of returning for these frequent injections at just the right time is just almost impossible to maintain. So having this backbone therapy, this sustained level of anti-VEGF treatment that may need additional supplementation in some eyes, but that in many seems to be sufficient, at least out to 2 years, I think is really going to result in better vision for our patients. I think for retina specialists, we live in a tremendously exciting time. Lots of new treatment options are going to be coming to us, I hope, within the next 2 or 3 years. But gene therapy to me is one of the most compelling, particularly if it can be delivered with an intravitreal injection with which we're all familiar, with great safety and with the sort of results that we presented today. Part of the challenge, but also the pleasure of being a retina specialist is trying to understand all this data, trying to pick the best therapy for our patients. So until we know a little bit more, until we know which drugs actually are approved, it's premature to say how I would pick among them, but I actually look forward to that challenge, and it'll just be great to have more options for our patients.